Hi, everybody. My name is Scott Rudder. I am the president of the New Jersey Cannabis Business Association. We are joined here today by the Honorable Jeff Brown. He is the Assistant Commissioner of the New Jersey Department of Health. And more specifically, he heads up the medical marijuana program for the state of New Jersey. Welcome, Jeff.
Thanks, Scott. Good to be here.
So we've had quite the interesting year, right? So we've had the start of this year with seemed like everything's going great in 2020. COVID obviously hit. I know that New Jersey Department of Health, Governor Murphy and Murphy administration all stepped up. And so why don't you give us a little bit of background on what happened back then with Department of Health and some of the challenges that you guys had to do in dealing with the COVID crisis?
Yeah, I mean, this is everybody's first pandemic. Nobody's been through one of these before, at least, certainly on our team. But I think everybody really banded together, and we've done a tremendous job here at Health and across all state government at addressing the pandemic, helping keep New Jerseyans safe, and really helping the overall healthcare system and really the economy as a whole really weather this storm. What that meant for me specifically was obviously being at the Department of Health. My day job is medical cannabis and overseeing the division of medicinal marijuana. But I was asked back in March to jump in and help out with coordination of hospital resources in the southern region of New Jersey. We built out and implemented a field medical station at the Atlantic City Convention Center. So I was responsible for, on the DOH side, working with State Office of Emergency Management on that project. We also had a contingent from the National Department of Defense join us, basically a team of about 85 military medical specialists, physicians, nurses, medics. And it was really an incredible experience. The good news is we didn't really have to use it that much because because of some moves that the commissioner made with hospitals in terms of asking them to double their bed capacity. And also, the fact that the virus wasn't really as far spread in South Jersey when the stay-at-home orders went into effect. We didn't see the need like we saw in some of our field medical stations up north, i.e. the one in Secaucus, which saw about 250 patients, and then the one in Edison, which I think saw around 150 to 200 patients come through there. In total, the three of them had 550 patients come through. Now that that first wave has we're kind of on the tail end of that in New Jersey, and obviously things are spiking elsewhere in the country, which we're concerned about. But I've been working with the team here on continuing to ramp up testing. The good news is that testing is pretty ramped up across the state. We're getting somewhere around 20,000 tests per day. Positivity rates are down, which is what we want to see. And kudos to the commissioner and to the governor. It's been an honor to serve in this administration, serve with them, and really help out with this whole endeavor.
Yeah, well, I mean, you guys, like you said, it's everybody's first pandemic. It's quite a big deal. A lot of resources put into it. So again, thank you for your service and your team's service and everybody in the state and what they've been doing and cooperating with the new rules and all that good stuff. So, again, Jeff,
yeah, absolutely. But I also, want to give a special shout out to the team here at the Division of Medical Marijuana because, what I think enabled me to jump in on some of those other initiatives is that they really kept the ship going here pretty well throughout this whole crisis. We made some policy changes that helped out on the industry side, but the team here showed up for work diligently, and continues to get the job done in a challenging situation.
Yeah, and again, it's that coordinated effort again with the ATCs that we saw. So in the beginning of the crisis, we all the ATCs experienced very long lines. I think a lot of people were getting nervous, so they wanted to stock up on their medication. So we saw these 3, 4, 5, 6 hour long lines, or sometimes supply was running out in the beginning. So what's your impression what happened then, and what steps did you do along with the ATCs to sort of mitigate some of those challenges?
Yeah, well, first off, just to sort of level set what we saw, I think people were saying that there were lines everywhere. They were saying that there were product shortages and that there was a supply crunch. And what we actually saw was not an overall supply crunch, but we saw some ATCs run low on packaged products. So they have, an alternative treatment center. Given that we have vertically integrated businesses here, that is, they cultivate, they manufacture, they dispense. They'll often have substantial amount of product in bulk, and then they need to get that into package form that involves packaging, labeling, all that stuff. Sometimes it's curing, so they got to wait for the curing process to complete. But so we had plenty of product, and we still have plenty of product today. The issue was that there were a couple ATCs where they ran low on packaged product, and because of the the increase in volume in terms of patients coming in and wanting to purchase, in the early days of the pandemic, they ran through those products, and then it was hard for them to devote staff resources to go and help with the packaging. So we did see that happen. There were a couple ATCs that really had long lines. I'll tell you, the average across the market when things were at their height was an hour wait time at the dispensaries. And when we saw that happening, we realized that we had to act pretty quickly. I mean, we had already been pushing out information from our communicable disease service here at the Department of Health to ATCs to help them understand what sort of precautions they should be taking to stop the spread of COVID, what sort of sanitation measures, things like that. But towards the end of March into early April, we recognized we had to make some policy moves to make it easier for businesses to work in this environment. The governor labeled alternative treatment centers as essential businesses. So not every state did that, but here in New Jersey, we did give them that essential designation, which allowed them to stay open. But so some things we did, we enabled for the first time volume-based discounts. So to encourage people to purchase more when they're making trips to ATCs, we allowed ATCs to give discounts based on volume. Previously, they could only give discounts based on things like if you're a veteran, a senior, a minor, or on government assistance. We allowed them to do telephonic consultations. So they generally do, particularly with new patients, an in-person consultation when they first come to the ATC. So we allowed them to do that telephonically so that they didn't have to take up time actually meeting in person with patients. We reduced caregiver fees across the board to help patients get caregivers. So it used to be caregiver fees basically mirrored patient registration fees. It was $100 every 2 years, or $20 if you were a senior on government assistance or a veteran. So now caregivers are $20 across the board. That registration fee is reduced. And patients, because of the law that was signed last summer, can have more than one caregiver. So, by doing that, we enabled patients who maybe didn't want to go out to the dispensary themselves due to medical reasons, could utilize a caregiver or multiple caregivers to do that. Because ATCs, like any essential businesses, faced labor challenges, i.e., when schools are shut down, and childcare is shut down, parents, don't really have much choice but to stay home with their kids.
Right.
And if you have a job that requires you to be in person at a place like at an ATC, that can make it challenging. So I know there was some ATCs dealt with employee turnover certainly in the early days of the pandemic. And so what we did, we basically allowed a waiver to get employees onboarded more quickly. So rather than going to the state system immediately for a criminal background check, we allowed the ATCs to submit basically third-party background check results just to show us that the person doesn't have any disqualifying convictions, and then they could get a background check through the state system at a later time. So that that really reduced the time it takes to get an employee on board from a matter of weeks to a matter of days. So that was really helpful. And then the last two things, which were our biggest moves, the first was allowing for curbside pickup, and we did that in I believe early April. and had some folks implement it pretty quickly. It's been working out pretty well. I think, on top of the curbside pickup, we've seen some ATCs use some like wait list apps so that people don't actually have to like wait at the ATC in person. There was one ATC that I'm not going to mention them by name, but they had a system that resulted in very long lines, people waiting, like you said.
I think that was the one that got most of the attention. It's probably why a lot of people think that was happening at all the ATCs.
Yeah, that's the one that got the most attention, but it was not industry wide. So we worked with them, and they changed their system around and got their wait times down. And now they still, I haven't looked at it recently, but after they implemented their new system, they still had a lot of people showing up first thing in the morning. But pretty much it was, you walk in and get served in the afternoons. And I'll mention, I think GTI in Patterson or Rise is the name of their dispensary, and The Botanist in Atlantic City were two where, they may have had some waits, but it was never over like say 30 minutes. And overall things have adjusted, and where we were at an hour across the industry average, we're now under 20 minutes across the industry average to time it takes to get served. And we've seen the average number of patients served across the industry increase by about an average of 50. Making progress there. I think that the industry as a whole has done an incredible job at adjusting to the pandemic. Testament to them that we only had a handful of positive cases by employees at dispensaries. I mean, that shows that they were doing the right things as far as sanitation, as far as disease management protocols, there's certainly some other places where that was not the case, but here in New Jersey, they did a really good job at keeping people safe and continuing to serve the patient population.
That's awesome. And it's awesome to hear too. And it was very innovative. The one closest to me, I know just, how they operated, and they're being very aggressive in the beginning, making sure that they could help facilitate patients' time. And you would go in there and register, and you would give them your cell phone number, and then they'd send you a text. So if it was going to be a 2-hour wait, that's okay. You didn't have to stay in line. You could do some other errands. So I know a lot of innovation and creativeness was going on. So in 2018, we had new licenses. We had another 6 that were awarded. What's the status on the what we call the new 6?
They've all been moving ahead. So they're all cultivating. All 6 of them have cultivation permits. I believe the last one was issued sometime around the end of March. Most of them received them between December and the beginning of February of this year. That's a pretty quick timeline. I think if you think about how long it took the original 6 to get operational, we saw 3 years, 5 years. Certainly, I think there was one that was fairly quick, but that was not par for the course. One opened in 2015. I think one was 2014, and then Harmony. That was one that we opened up under our watch. 27 years after the original RFA back in 2011. People have told me it takes 3 to 5 years to open a supermarket in New Jersey, and so when we're talking about medical cannabis, everything becomes more complicated, I think they started out slow in the implementation, and we had a meeting of the minds, shall we say, in early September of 2019. And really pushed them to kick things into high gear, and they did. And so we now have, Columbia Care has an open dispensary, Verano has an open dispensary, and GTI has an open dispensary. So they're all dispensing product, and both Verano and GTI, I'm excited to say, are now not only selling product that they're purchasing from other ATCs, but they have their own flower that they're also selling. We're seeing the first the first products coming online from 2 years ago, it was less than 2 years ago. December 2018 was when the awards occurred. But there's still some hanging out there that we need to open up. So MPX in Atlantic City, Justice Grown in Ewing, and Terrace End, which is going to have their dispensary in Phillipsburg. We want to see them open up pretty quickly here.
Yep. So you mentioned different product offerings. So what's currently available now for patients to have access to, and do you see new things coming online? I know that there's all these different offerings in other states, and people are always inquiring, hey, when are we going to get this? And hey, when can we get that? So what's allowable now, and what do you see on the horizon?
Yeah. So now we have flour, topicals, so like ointments, things of that nature, topical oils, lozenges, and soft lozenges, so both hard and soft lozenges, as well as concentrated oil. So that's what's available on the market now is generally, as far as concentrated oil, around 70% THC. And then, I'll note that last year, the new law that was signed, Jay Koenig's law, does allow for expanded product offerings. So, in 2018, we were operating under the Christie era law, and now we're operating under the new law that Governor Murphy signed, and that enables us to approve a whole wide variety of new products, including edible products. So we've asked the ATCs to go into their sort of think about what products they want to offer, come up with some innovative ideas, and pitch them to us. And we have a number of product waivers that are currently under review, so we hope to have some of those going pretty soon here.
Awesome. And awesome, because it is like, we talked about COVID, but as we recall last year, there was the vape crisis, and people, of course, that was, the CDC had since determined that was almost entirely counterfeit vapes from a single source out in California. And all the ATCs here, they follow the rules of the Department of Health, and so we know what the ingredients are. So I know there's a lot of restrictions on that. But so having those other offerings, for there's tinctures or otherwise, I know it's a high interest right now, and so I'm glad to see. So right now it's just a matter of an ATC having the ability or willingness to start to expand their product offerings. Is that the case, or at least pitch it to you?
Yep, that's right. And it's got to be compliant with what's in the statute. The statute outlines, product categories, and we have the ability to expound upon that via regulation in the future, and we certainly intend to. But in the meantime, we've said we'll look at product waivers, and that's what we want to do, because we want patients to have access to a wide variety of products all over the market. And you mentioned the vape crisis. That seems like forever ago.
Simply at times.
Yeah. That was it was interesting because we were, again, for different reasons there. I was working hand in hand with our state epidemiologist and her team as they were tracking the vaping related lung injuries. And we were on a daily basis ensuring that none of the folks affected by that were patients, and or that any of that was related to any products in New Jersey. We have never approved anything with vitamin E acetate, which seems to be one of the culprits. So that's good news there. And there were no associations between any of the cases and any products sold in the regulated market here in New Jersey.
Awesome. So, a question I get a lot, just either in my position here or just a person around town, but when we talk about, doctors prescribing medication, when it comes to medicinal cannabis, it's a recommendation. What's the technical difference between a recommendation and a prescription?
So I'm not an attorney myself. My understanding of that is it all stems from the fact that legally cannabis is considered a Schedule I drug. And I think if it's Schedule I, then it's determined by law to not have any medical benefit, and so those are things that you can't necessarily prescribe, and so that's why we use the term recommend or authorize, or
right.
Under the old statute it was certify. That, I think that's the genesis of why that is. Certainly if somebody was Epidiolex, which is the plant-derived CBD drug, I believe it's Schedule 5, so that can be prescribed because it's not Schedule 1.
Right, right. So we have, so we mentioned Jake Honig's law last year. You expanded the ability for other people to prescribe or recommend, in this case, medical cannabis. Who was advanced into that, and who can make these recommendations, and what's the status of allowing other medical professionals to make these recommendations?
Yeah, so the law added advanced practice nurses and physician assistants as healthcare practitioners that can authorize a patient for the use of medical cannabis. And so that's a piece that we haven't implemented yet. I'm happy to say that the module to enable that in our registry is in testing currently, and we hope to have it rolled out very, very soon. We're really in the final stages there, and just need to sort of dot the I's and cross the T's, and we'll be ready to go. Even before that, though, we made some regulatory moves that made it easier on physicians, particularly allowing them to opt out of being listed publicly. We have a lot of physicians might have a handful of patients or something, don't want to be listed publicly. So we did that. We streamlined the physician registration process. And so, even before we've made it available to APNs and physician assistants, we've more than doubled the number of physicians in the program. We were at about 500 when Governor Murphy took office. We're now close to 1,200 physicians who are recommending medical cannabis. So only more to come there.
That's awesome. Great to hear that. What about other medical professionals, like if dentists or psychiatrists, if they want to make these recommendations for their patients, whether it's for anxiety or for pain mitigation? Is that something that would have to be done legislatively, or is that something you could do through regulations?
Yeah, I mean, again, I'm not an attorney, but my read of that is that it would need to happen through legislation.
Okay.
The statute, it says physicians, APNs, and physician assistants.
So when we talk about patients, we talked about some of the different product offerings that are available. A lot of concerns that both the patient and employers have, and where can people take their medication outside the home? Like what's an allowable situation where I'm outside the house? What are the limitations? Where can I have access to or gain access to for be able to take my medication?
Yeah, I mean, I think it's tough to answer that question just because I'm not fully aware of every municipal ordinance that might come into play in that.
Sure.
So it's really important for patients, caregivers, anybody involved to just look at what's on the book, both on a state level and more locally too. Now I do know that there are certain places where it's prohibited. I believe public parks and beaches, things of that nature. But generally, patients are protected under state law to both possess and use. So unless it's expressly prohibited, i.e. it's private property or it's expressly prohibited by the statute or by something else, then patients are protected.
Right. And I know a lot of it's, some of it's just, it's a nuance, right? So if I'm taking, a lozenge, like you said, and, that's something that's very discreet and that's something that wouldn't impact anybody else. I think most people are concerned about, vaping or smoking and the impact. And it's been my understanding, and I think most people follow this, is wherever I'm allowed, if someone's allowed to smoke a cigarette in that environment, someone could take their medical cannabis in that environment too, if they're smoking or vaping. Is that your sort of rule?
I mean, I would just say, like I said, as long as it's not expressly prohibited, and the statute does call out some particular areas, like beaches where it is prohibited. But as long as it's not expressly prohibited by that, or, certainly smoking prohibitions come into play because, they apply to whether you're smoking tobacco or something else. So, it's just really important that people be informed about what they need to do. So consult the statute, look what the carve outs are for where you can't consume, and really those mostly apply to smoking, but otherwise patients are protected to use and possess.
Good. So the other thing where patients have concerns, and I whether during COVID or otherwise, when someone goes to the hospital, they don't want to take the opioids. So a lot of former opioid addicts have transitioned to medicinal cannabis for pain mitigation. What's your, I know that we try to address some of these things in Jay Koenig's law. Like, what is your, could you explain to people what limitations are in either healthcare facilities, like a hospital, or long-term care facilities, nursing home? What limitations, what access do they have?
I think what the patient community has to understand when it comes to hospitals, nursing homes, healthcare facilities like that, is that the state government is one regulator, but the much broader and more powerful regulator in those contexts is the federal government. And cannabis is illegal under federal law. Federal law does not recognize medicinal cannabis. It doesn't recognize recreational cannabis. It's been the position of attorney generals, going back to Obama era, to kind of have a hands-off approach for what's going on in states. But that doesn't mean that CMS is going to condone hospitals being able to, allow patients to consume on their property and stuff like that. And healthcare facilities like hospitals and nursing homes, while you might have folks there who, if it were entirely up to them, would be willing to accommodate a patient's right to use, they see it as a big risk given the federal government's stance on cannabis. And it's an unfortunate place to be, but I think it's one that we have to kind of just recognize exists until something changes federally. We've certainly at the department made a coordinated effort to educate the healthcare system as a whole about cannabis. So the former commissioner, Sharif Elmahal, who is now the CEO at University Hospital in Newark, he did a series of grand rounds at hospitals all over the state, talking about the benefits of medical cannabis and things of that nature. And we went as far as to say point blank that there's really, there's little risk to a hospital to simply allow a patient to sort of store it while they're on site. Things beyond that, all of this, it's really up to a hospital and their counsel to determine just how much risk they want to take.
And I think year after year, you hear more anecdotally about patients being allowed to do it, or it's either a sympathetic nurse or doctor or just the administration in general at that healthcare facility. So when we're talking about, patients,
Scott, I got like a couple more minutes here, and then I got to jump to another call.
All right. Oh, that's great. So let's talk about, then let's jump down to, we have a ballot question coming up, right? So that's going to have, assuming it passes, we're going to have adult use for cannabis here in the state of New Jersey. What's your impression of how this is going to impact the medical program?
Yeah, it will have an impact on the medical program. I know that much is certain. I think beyond that, it's sort of prognosticating based on what's happened in other states. I think we've set the I think we've made some moves to set the stage for a continually thriving medical program here in New Jersey. The first of those is phasing out the sales tax. So the first reduction in that happened earlier this month. Dropped from 6.678 whatever it was percent to 4%, and it'll drop over the next couple of years down to 0. But I think there's some other things we can do. If adult use cannabis passes, we're going to want to make it as easy as possible for a patient to sign up for medical cannabis, because certainly my opinion that if somebody's going to use it medically for a medical reason, then you want them to use it in concert with other medications and under the supervision of a physician or APN or physician assistant. And if it's if it's hard for patients to get registered and get a card, i.e. it costs a lot of money or it takes a lot of time to get a card, then they're just not going to do it. So I think behavioral economics come into play, and certainly what we're thinking about is how do we make it as frictionless as possible to get a medical card once we move into recreational context. And we've already done some of it. We've reduced fees. I think hopefully we can do that further in the future. Before last year we reduced card processing times down to really a matter of days. Unfortunately, because of COVID and some other constraints, we're now up to about 3 weeks. But once we get through through this, then really going to focus on getting that back down to a matter of days. My hope is that we can figure out a regulatory framework to get people, virtually instantaneous cards. Go to the physician, right, and then find a mechanism to get a card printed as soon as possible and in their hands.
Jeff, you have done an amazing job there, you and your team at the Department of Health with the program, and it really has accelerated significantly since you came on board. So on behalf of patients everywhere, thank you. And also on behalf of the New Jersey Cannabis Business Association, Jeff, thank you for your time here and continue the great work that you guys have been doing.
Thank you very much. I appreciate it.
All right, take care, Jeff. Thank you.